Today I'm going to talk about how is my approach for dealing with musculoskeletal injuries. In my experience, I realized that there isn't one technique, one approach that's going to resolve all the problems. I think a lot of us are looking for like the miracle technique, the miracle pill, the miracle supplement that is going to cure everything. Well, in my experience, if you're limited to one particular method or one particular approach, you're going to be limited for helping patients. So I'm going to explain to you why it's important to have a multifactorial approach of techniques and treatment modalities when dealing with injuries. I'm going to show you one diagram here. Now this diagram basically shows a system that protects us constantly. This system is made up by alignment, the muscle support, the ligamentous system, the cartilage, and the bone. If this system is in place, we don't get injured. Now I'm going to give an example, right? Let's talk about the knee. But the knee has the same principles as the shoulder, as the lower back. You just change the location. But for that video, just to simplify the example, let's talk about the knee. For example, if a patient develops a meniscus problem, which is very common, right? It could be also a disc problem, right? But again, let's talk about the knee. For the meniscus to be damaged is because all the previous defense mechanisms fail to protect the meniscus. So if I want to help someone with a meniscus problem, I have to help the meniscus, I have to heal the ligaments, I have to heal the muscles and strengthen the muscles, and I have to realign the joint. That's why there isn't one technique that's going to resolve all these problems. So how we're going to heal all of these layers? Well, we need different types of techniques, different types of technologies to enhance the healing. So for example, for cartilage healing, we have to use low-level laser, PEMF, essential oils, right? This will help to heal most of the soft tissue injuries. Now, the muscle support, we have to stretch, we have to strengthen, right? Specific exercises. And the most important thing is this, alignment. A lot of healthcare practitioners, they just forget about this. And this is the foundation of the body. If we don't realign the joint, regardless what type of injury you have, you cannot help the patient long run. You can reduce the pain, but we're not going to be able to prevent this to happen again. The idea of my treatment is to restore every single layer, enhance the healing of every single layer, restore your defense mechanism, and prevent this to happen again. That's the only approach to be able to resolve the problem and prevent this to happen again. Now, if I only have one treatment, one type of technique, I won't be able to restore this. That's why it's very important to be able to add different types of treatment modalities and treatment philosophies into your toolbox so you can help patients with all sorts of problems. Just coming back to this diagram, I put the number here on the side, 1, 2, 3, 4, 5. This is what I call, I classify this as level 1, 2, 3, 4, and 5. What means is, higher the level of injury, higher the level of tissue damage. All right? If someone has a stress fracture, which is a problem right on the bone, fracture on the bone, is a level 5, meaning that patient has a fracture, have a cartilage damage, ligamentous damage, muscle weakness, and misalignment. If a patient has a level 3, when you sprain your ankle, for example, you have a level 3. You damage up to the ligament. Now we have to heal ligaments, strengthen the muscles, and realign the joint. Right? So again, this is a very systematic way of diagnosing injury and a very systematic way of treating. And I'm very confident with this approach. I help many patients not only reduce the pain, but resolve the problem and prevent this to happen again.